Okay, hi guys, I'm Wang, and today we are going to read the medical news. Tackle obesity to drop risks for secondary cardiac events. Patients who had been hospitalized for heart attack or cardiovascular revascularization procedures commonly were overweight and had obesity. But at a follow-up visit, Phil had lost weight or planned to do so, say researchers conducting a large European study. The findings emphasize that obesity needs to be recognized as a disease and that has to be optimally managed to lessen the risk for a secondary cardiovascular event, the author stressed. Okay, get rid of. The researchers analyzed data from more than 10,000 patients in the Europe by fourth and fifth studies who were hospitalized for acute myocardial infarction, coronary artery bypass graft, or percutaneous coronary intervention, and answered a survey on average 16 months later. Although 20% of patients with obesity had lost 5% more of their initial weight, 16% had gained 5% or more of their initial weight. Notably, the district later did not record the weight status in a quarter of the patients with obesity, and a substantial proportion reported to have never been told by healthcare professionals that they were overweight, the researchers report. It seems the Barker and colleagues write that obesity is not considered by physicians as a serious medical problem, so which requires attention, recommendations, and obvious advice on personal weight targets. However, the benefits for patients who lost weight in our study resulting in a healthier cardiovascular risk profile are really worthwhile, they point out. Cardiovascular rehabilitation should include weight loss prevention. The safest and most effective approach for managing body weight in patients with coronary artery disease and obesity is adopting a healthy eating pattern and increasing levels of physical activity, they write. And their findings that patients who reported in reducing their fat and sugar intake, consuming more fruit, vegetables, and fish, and doing more regular physical activity has significant weight loss. Support this. The Barco and colleagues recommend that cardiovascular prevention and rehabilitation programs should include weight loss intervention, including different forms of self-support as a specific component of a comprehensive intervention to reduce total cardiovascular risk, extend life expectancy, and improve quality of life. Clinicians should consider the incremental value of telehealth intervention as well as recently described pharmacology interventions. They add, but noted the study did not look at these options or metabolic surgery. surgery. Invited to comment, one expert pointed out that two new observational studies and metabolic surgery in patients with obesity and coronary artery disease reported positive outcomes. Another expert took issue with the patient blaming tone of the article and the lack of actionable ways to help patients lose weight. Medical therapy or bariatric surgery as other options. The study demonstrated how prevalent obesity is in patients with heart disease and confirmed how difficult it is to achieve weight loss, in particular in patients with heart disease where weight loss could be beneficial. Even though current guidelines stress weight loss controlling, some patients actually gained weight. Observed non blah blah. On the other hand, patients who lost 5% or more of their initial weight had reduced comorbidities that has that are associated with cardiovascular disease. The best way to achieve long-term weight loss in patients with severe obesity is metabolic bariatric surgery who was not involved in the study. Oh my god. There are now two recent papers of the journal circulation that demonstrate that metabolic surgery has a role in the secondary prevention of cardiovascular disease in patients with severe obesity. However, those were observation studies and the findings could need to be confirmed in a randomized clinical trial before they could be used as recommended practice of care, he cautions. In addition, most patients in the current study could not fulfill the minimum body weight criteria for metabolic surgery. Therefore, there is a need for intensified medical therapy for these patients as another treatment option. It could be interesting, he speculated, to study how the new glucagon-like peptide 1 receptor agonist therapies could work in this setting as a weight loss agent and perhaps have positive independent cardiovascular benefit. Obesity is a disease clinicians need to be respectful. Meanwhile, Obesity Associate Meanwhile, Obesity Society fellow and spokesperson Fatima told Medscape she didn't think the language and tone of the article was respectful for patients with obesity, and the researchers talked about the old narrative of how we support patients with obesity. Lifestyle modification can be at the core of treatment, but medication or bariatric surgery may be other options to help patients get their best selves. Patients with obesity deserve to be cared for and treated with respect, says Stanford, an obesity medicine physician, scientist, blah blah. Treatment needs to be individualized, and clinicians need to listen to patient concerns. For example, a patient with obesity may not be able to follow advice to walk more. I can barely stand up. One patient with obesity and arthritis told Stanford. And patients' insurance may not cover cardiac rehabilitation, especially patients from racial minority or those with lower socioeconomic status, she noted. My feeling has always been that it is important to be respectful to all patients. I do agree that we need to recognize obesity as a chronic disease, and the paper in EHJ demonstrates this, as obesity was not registered in many of districts not. If we as healthcare workers measured a weight of our patients the same way that we take a blood pressure, he said, perhaps the stigma of obesity could be reduced. Study findings. The researchers examined pooled data from EuroAspire surveys of patients who were overweight or had obesity, who had been discharged from hospital after MD, KABG, and or PCI to determine if they had received lifestyle advice or for weight loss, if they had acted on this advice, and if losing weight altered their cardiovascular disease risk factors. They identified 10,507 older patients in 29 mainly European countries who had complete survey data. The participants had a mean age of 63 at the time of their hospitalization. 25% were women. Many had hypertension, dyslipidemia, or diabetes. The prevalence of obesity varied from 8 to 46% in men, and from 18 to 57 in women. In different countries, patients with obesity had mean body weight or 97 kilograms. One of the most striking findings was the appearing lack of motivation to lose weight. Half of the patients with obesity had not attempted to lose weight in the month before the follow-up visit, and most did not plan to do so in the following month. Goal setting is an important aspect of behavior modification techniques. They write, yes, 7% of the patients did not know their body weight, and 21% did not have an optimal weight target. Half of the patients had been advised to follow a cardiac rehabilitation program, and 2/3 had been advised to follow dietary recommendations and move more. Oh my god. Those who made positive dietary changes and were more physically those who made positive dietary changes and were more physically active were more likely to lose at least 5% of their weight, and patients who lost at least 5% of their initial weight were less likely to have hypertension, dyslipidemia, and diabetes compared with patients who had gained this much weight, which is likely to translate into improved prognosis on the long term, the authors write. Okay, that's all.